Hi folks, Ian Cameron here, coming to you from my home office. Wanted to update you on what constitutes an emergency. You'll know if you've been in touch with the practice or looked at our website that all face-to-face optometry has now been cancelled in Scotland, and the only things that can be seen in person are emergencies. Of course, we can provide information and advice over the phone. We can do that by Zoom or FaceTime or whatever, and actually you can do quite a lot over the phone. So if you're in trouble or there's any problem with your eyes, then of course you call us and I'll take care of that. Happy to help you with that. I've got my prescription pad here, so I can even prescribe medications as required for eye conditions. But things that need to be seen are things that are very serious and sight threatening, and those would be things like red eyes where vision is affected, where the eye is significantly painful, or where it's sensitive to light. It's quite common to get an uncomfortable, sticky eye, but when an eye is genuinely painful, when it's stopping you from sleeping or stopping you from working because it's so sore, when it's sensitive to light, these are the kind of things that are warning signs, and particularly when the vision is affected. The other thing to watch out for would be symptoms of problems with the retina, and that would be things like a sudden onset of flashes and floaters. Many of you will be familiar with floaters, the wee twinkly tadpoles you sometimes see in your vision, but if it's combined with a sudden rush of these floaters, particularly with twinkly lights around the edge parts of the eye, anything like a curtain coming over the eye, anything that obscures the vision in any serious way, that's something I'm going to need to hear from you about. The general principle with eyes is the sooner or the quicker it comes on, the quicker you need to get some advice on what to do. So things that grumble on over the course of a week are usually less serious than things that just start at one particular moment. So you wake up one day, you can't see out of one eye. That's potentially something very serious, and so you need to get in touch with me straight away. The best way to reach me is either by email for slightly less urgent things. You can get that vision@cameronoptom.com. that will come through to me. I can deal with that. Or if you've got something that's more urgent, call the main practice line 0131 225 2235. We can advise you over the phone, and we can tell you how to be seen face to face if that's absolutely essential. But first port of call, phone us. The last thing we want to do is be using up NHS resources by going to the GP, the pharmacist, the A&E or minor injury. So stay out of there, call us first and we'll take care of you. Hope you're doing well wherever you are, and I'll be back with some more hints and tips about eye care in isolation soon.